Hello, everyone. Dr. Bolden here from Wellness Restoration. I'm kind of putting together a video today for everybody to give you some background on what we do and how we do it. And some of you all may already know who I am in the industry, infusion industry, from the name Restoritrol or NAD, Neuronutrient Infusion Neurotherapy. Uh, what What I'd like to do today is kind of go in reverse and give you a little bit of history, a little bit of background, where it's being used, how long has it been around, and where it's being utilized in certain parts of the country. I am currently at Wellness Restoration, Dr. Castellano, provider, MD, EM doc for 30 plus years, board certified, and who is has provided amazing care for many people over his tenure as an EM physician, and he has branched out into the private sector and now doing functional healthcare and fancy terminology for more naturopathic, holistic approaches and remedies to getting folks feeling better and having a better quality of life. Versus just using medication. That doesn't mean that you stop using medication or withhold medication, but it's utilizing naturopathic concepts to heal the body and the brain, be it different pathologies. So, again, my name is Dr. Bolden. I go by Jay. I'm pretty informal these days. I am the principal investigator and chief scientist of Neuroscience Institute on Addiction. And we've been studying Restoritrol, which is the trademark name for NAD Neuronutrient Infusion, since about 2015, when they were utilizing amino acids and specific cofactor, which is a fancy term for vitamins, to help bring people around and heal the brain and body very quickly and give the body what it needs so it can optimize its output. And all the tissues, so they're all connecting, and the inner workings of all of the organ systems and biochemistry and physiology are acting in its most optimal level. So let's not get too bogged down into that, but we have been working and doing research in the substance use disorder mental health space, using Restoritrol NAD as an adjunct. And I like to say this early on and at the end. What we do at any clinic, especially in working with substance use disorder folks who have been dealing with addiction issues, it is not a standalone therapy because it is only working on the biological and physiological aspects of the addiction mechanisms. It is not a standalone. It's not meant to be used alone. It's meant to be used with a comprehensive integrated treatment plan, ASAM and SAMHSA-based treatment program, recovery program that you're working with licensed professionals, a team of professionals. We are only one segment and one side to that. And what we have found over across the continuum of all ages, all genders, all substance use histories, abuse histories, polysubstance abuse histories of the severest kind, also to the moderate and mild kind. Even at gaming, social media, sexual addiction, gambling, those are all acting in the same areas in the reward circuitry of the brain, which we will not typically go into today, but we have plenty of reference material on the website. And you're welcome to dig in and look at the evidence-based concepts and reference research papers. So I always state that, and I like to put that in the very beginning. The infusion procedure and protocol, they've got to be used and concurrently with validated treatment programs. This is not a standalone treatment. Yes, you will feel better. Yes, it does do amazing things for you in conjunction with the other medication and MAT that you may be on, but it is designed to be part of a treatment plan, and that's important. Okay. So what are we trying to do? Looking at the little neuroreceptor there, we are restoring, repairing, and regenerating neuroreceptors, neurotransmitters, okay, and increasing overall cognitive brain function. That's the result, okay, and that's what we see in the validated assessments that we do pre and post test, the validated imaging, and the QEEGs and the neuroguide imaging. We've also shown and backed that up with SPECT imaging and MRIs. So you can kind of see the before and after of whether or not you're seeing any evidence at the scientific and diagnostic level. Because what we do is we get great validated surveys and everyone feels great and wonderful, but that's not good enough as a scientist and for providers. This is a medically necessary and relevant and rational management protocol. And it's, like I said, used in conjunction. It is all natural, drug free. It can be used in conjunction with your psychiatrist. And again, we would consult with the psychiatrist if there's organic brain diseases, and the provider that you see and your psychiatrist that you would see would be in part of that decision. But really, what we're doing here, if you look at it from a concept of nutrition, we're doing bionutritional. We're giving you hypercharged, hyperconcentrated micronutrients in IV at a very slow rate and safe rate, which are basically getting all the nutrition that your body would need, which we have a hard time doing, especially in the amino acid side, and getting the right proteins and peptide complexes to help our tissues heal, giving it the brick and mortar. The cells waiting on the substrates, the bricks and the mortar to build the house. And unless you provide all that, the proper nutrition from a holistic and naturopathic approach, then it's hard for your cells to optimize. And most importantly, the engine of the cell, the NAD neuronutrient, is designed at very high concentrations to heal and energize and regenerate. Let me back up, not regenerate, but restore the optimized function of the mitochondria. And that's important because every cell in your body has mitochondria. And if they're not optimized, you don't have any power in the cell. And oxidative phosphorylation, which is fancy terminology for the breathing, how we bring oxygen in and set off CO2, and how we transfer ATP and ADP, and how we that phosphate bond, and how we break it in the mitochondria. So don't want to get too far off into left field here on the molecular biology concepts. What we do is not novel in its concept. It's been around for 50 plus years. They call it in in ICU wards TPN, total parental nutrition, and they use depending on what your body needs. You have, if you're not able to eat, you have to have nutrition in order for your body to heal and also work appropriately. So those are the concepts. One of my favorite researchers of NAD is Dr. David Sinclair at Harvard. He is the maverick and the guru, the anti-aging guru. He has pioneered NAD research and shown proven concepts of it being utilized in all areas of healthcare. And this is just one area. This is, one segment of healthcare that we work in. And we're really we're achieving a total restoration and recalibration and regeneration of new cellular response and reaction for cellular growth and repair. That's not a novel concept. Your body will do that. We're born to die. Our body starts dying from the day we're born. How do we turn that clock back? We have to keep it healthy. So it's important to reiterate that we're using all natural compounds and components, from saline, NAD, to cofactors at specific concentrations, specific cofactors, specific amino acids and peptide complexes. And again, these are all naturally occurring in the foods we eat, but we typically don't eat the foods that have everything we need. Okay, so we're hypercharged IVs that are providing these nutrients and getting your body to come around very, very quickly. So in the substance use disorder segment and mental health, what we're seeing is the resolution and reparation and reconciliation, fancy terms for post-acute withdrawal sequela, shortening that time clock and that time span of those withdrawal symptoms and sequela that create all the anxiety and substance-induced mood disorders. And when that is shortened and healed, then those folks focus and concentrate and have better cognitive and more gusto, if you will, for their treatment plans when they're in treatment. with proper licensed in a licensed facility to have the proper counseling and therapeutic setting for CBT and cognitive restructuring and mutual support groups and all those things in that comprehensive treatment plan that I talked about. That's so important for recovery. This is not a standalone. We don't just help you heal and reparate your brain and the reward circuitry and then send you off. We would rather not do it. And we work with licensed facilities and providers that are going to impart this as only part of that treatment plan. Okay. So where is it being used? Again, I go over all this on the website. We'll be happy to at Wellness Restoration with a phone number, email. We'll be happy to answer questions, schedule a consultation, an appointment to come in, or even come into the facility as providers to help you and your group learn what we do and provide those long-term positive outcomes that you're reaching for. And let me just finish up here. Where is it used? Addiction neurotherapy programs in all disorder of all known drugs of abuse and activities, mental health programs, PTSD, chronic stress, internal functional medicine like anti-inflammatory, autoimmune disorders, and even the neurodegenerative disease neurotherapy programs, which I don't do personally, but there are neurologists who are the specialists and the folks that are handling organic diseases like Alzheimer's and Parkinson's that are working NAD protocols and getting really great outcomes. It's not a cure, it's not a standalone, but they're improving quality of life for their patients, and that's what we're here to do: improve the quality of life and to help speed that recovery program up for those folks that have suffered from addiction or currently suffering from addiction in validated treatment programs. Okay, we are not a vitamin. Our concept is not a one and done or do 4 in a year and you're done. We're not a vitamin hydration clinic. And again, they do wonderful work and it has its place, but that's not what we do. We're much more medically necessary. We do lab diagnostics, we do imaging, and we also bill insurance, okay, versus having to just pay cash when you go to a vitamin hydration clinic. That in itself is a huge feather in our cap and moniker. It's taken years to develop and find that access and codes in order for us to provide more access to patients that need access to treatments like this, who don't want to take necessarily a lot of other medications, but utilize it as a bionutritional, IV bionutritional. Okay. So just kind of scrolling down here, who provides it? This is, again, not a ancillary team. You have doctors, nurse practitioners, licensed, professional, seasoned, qualified professionals that provide our, Restoritrol, NAD, Neuronutrient. Again, hydration and vitamin therapy is great for certain things like hangovers or inflammatory conditions or energy issues, athlete recovery. I mean, ours work really, really great for athletes. Athletes find it amazing after games and for what we call turnaround response times. And again, these are all naturally occurring components. So there's no downside to that. All right, just like going to a hydration vitamin clinic, you're going to get a great outcome. But is it that outcome for something specific? That's kind of how we look at it. And we do full workups for that. Okay. All right. We have 45 elemental compounds in Restoritrol. We don't divulge intellectual property, patent pending. We have provisional patents and patent pending formulas, and that are backed by science and backed by utilizing FDA passed components to build our compound. We don't use anything other than NAD, even though it's not approved specifically by the FDA. It's in that process, and it's been studied, and it's been looked at, and the FDA has provided a national drug code for it, even though it's considered an unclassified drug. But all the other ones we use are FDA approved and cleared compounds from Braun and Baxter and all big pharma companies. Again, they are not drugs. They are considered drugs by the FDA, but they're not. They're naturally occurring components. And I think it's important that, everyone understands we're providing specific substrates for the limbic system in the brain, so the brain can heal very, very quickly in those areas that are responsible for the mood disorders, behavioral issues, memory issues, addiction reward circuitry in the limbic system. And there's three little areas that we study as addiction neuroscientists, which is the nucleus accumbens, the VTA, which is the ventral tegmental area, and the amygdala. And those areas, in conjunction with the prefrontal cortex, is the circuit of the disease and addiction cycle of reward circuitry. And that's what we're trying to do, is heal those. Okay. Moving right along here, guys, and we'll just wrap this up. All right. Just showing you some of the evidence-based concepts. This is the D2-DR receptor. This is dopamine. We provide specific concentrations of valine, serine, phenylalanine, histine, cysteine, tryptophan. I don't need to go through a biochemistry lesson here, or a micronutrient lesson, but you get the idea. Again, more information. We do proper workups. It is medically necessary infusion. It is not just a basic hydration. You obviously have to look at all the comorbid issues that a patient may have. And at Wellness Restoration, who is the only one in Colorado right now that's offering the NAD Neuro Nutrient, they're going to be, again, that's our first home here. And we are here to provide medical care, not hydration of vitamins. So anyways, let's just move down and we'll wrap this up. I appreciate everyone being so patient. Again, few therapies available today are 100% naturally occurring molecular and cellular compounds and components, all looked at and and used by biochemists across the country. And we're waiting on some FDA approvals and having them look at our compounded, not the components, but at all together. And again, that's in process, and it's a little bit of a process, as you well know. And again, not to get into all the evidence-based proof of the biotechnology and the neurogenetics and nutrogenomics and neuronutrient. There's tons of research out there, everyone. You can go to Google, go to the NIH, go to ResearchGate. You're going to find tons of research on this. We're not the only ones out there doing it. We are the only ones that can provide a specific formula, very concentrated. And we also have the billing, so we can bill insurance for it. That's what separates us from everybody else. Our formula is specific for the neurotransmitters and the limbic system and the amino acids and areas that are important to help that physical recovery, the biological recovery, so you can work on the mental, behavioral, and spiritual concepts of your recovery. Okay. And moving right along, again, mechanisms, we won't really go over all that, but these concepts, looking at electron microscopes of before and after, of looking what healing and damaged D2s look like. Pretty impressive stuff. Dr. Sinclair, I follow him. He's the maverick of NAD. You just can't, this is not a guy you can argue with. I mean, he has all the credentials and all the science and the science teams and the money at Harvard to do the proper evidence-based research, peer-reviewed research that provides evidence of how good NAD is, and some of the other things that he studies, like NMN, and that's another conversation for another day. All right. And last thing is, when you come to Wellness Restoration, it's important to know that you're going to get a comprehensive workup. You're going to get a really nice, quaint, very boutique style, home felt practice where you can come and relax and come and feel comfortable and feel accommodated. But also that you're going to come and get a comprehensive level of care integrated. You're going to get proper lab diagnostics, and the feather in our cap, providing in-house, on the spot, NeuroGuide imaging, which is what you see on it's going to look just like this. You're going to get a test, a pre-test and a post-test. We will be able to, we bill insurance for that. We also do cash pay and sliding scale. That's whatever kind of fits your model. And we give you the pre and post-test imaging so you can see your report. Not only do you feel better, but let's show where those areas are improving. Okay. And essentially that's it. I appreciate your time, everyone. Thank you. Please give us a call at Wellness Restoration, and the numbers here on the website. We'll be happy to answer any questions you may have. and you can talk to myself or the staff and Dr. Castellano. He's absolutely amazing, and he has a video here on the website. And we really hope to see you soon and schedule an appointment for you and improve your quality of life. And with that, stay blessed, my friends. Thank you.